I'm going to do a virtual tour of our McAlester Skills Lab, and we're going to probably put this on a website for our Eastern Nursing Department also, so we wanted to kind of test it out with y'all first. First of all, this is a very up-to-date modern skills lab. I'm going to kind of span it around here for you. We're very proud of it over here at McAlester because we started out with nothing. When I came over here 3 years ago, because it's our third year to teach over here, then this room basically had the sinks and that was it. So I'm very proud of what we've done. We kind of built it from the ground up, and I came over here the first year by myself, and then I had Ms. Stanfield join me that first year, but pretty much it was a load of opening a new campus. But we've strived to really make sure that it stays very organized, very structured, and very clean. So you will find that that is throughout the whole scene here at McAlester, but especially in our skills lab. We don't want anything out of order, so we really do try to make sure that's done. But we have two sim-ins. Here's our first sim-in, and like I said, we can do full codes, and you will actually see where we have the machine here, and we can actually do codes, and it really does where we can shock them. So it really does shock. And I'll take you over here to the next area. We have about two areas over here. This area, like I said, we have we've been hooking up a computer today, but we have a gurney here that we can actually use, and then we have Noel. And everything here is up to date on Noel. We also now have a computer program that, I'll come over here and show you this computer program that we use. This right here will actually have fetal monitor tracing with the Noel, and we usually have it over there, but I have it charged up right now. And you actually can do some readings with this and take a look at it. And as you can see here, we're having a late decel. So we can turn on the sound on here. Let me do that. Switch hands with the camera. And get it to turn on there. It's preset as a custom, I think that's. Anyway, you can see there that we can actually do tracing, and we can have the sound on it, and I just haven't got it set. I've got it set for a custom right now. So anyway, come around here, we do all kind of pumps, so you'll learn a lot about pumps, hanging blood tubing, stuff like that. Like I said, we do have Noel and the infant. Over here we have, of course, our geriatric patient. We have an air mattress bed, everything for this patient right here. Over here we're going to have laptops, computers, and hopefully we'll have a program on them pretty soon where we can actually have you help do charting on them. Over here on this station right here is a virtual IV arm. I don't have it out yet. It's very sensitive when we take it out of the box, but you'll actually be able to practice IVs, and it will be able to check your accuracy. Over here we have another sim-man. So we're very fortunate to have two sim-mans over here. So, and we actually have you help hook up enteral feedings. That's an enteral feeding pump. And then we have a active board in here, which I really enjoy. I'm kind of addicted to active boards. I have one in my classroom and one here in the skills lab. And we can actually teach out of this room too if we need to for skills lab. And then I'm going to take you into the med room. The med room is we wanted it basically set up a lot like what you would go in, and when you get your medications, sign them out, stuff like that, have your chart, everything else like that. So we really wanted to have it set up a lot like that. And a lot of the medications and things that you see in here, I'll open up the cabinet for you. A lot of them, as you see here, it's regular medications. And we actually go through a lot of this here with you. We do full-blown simulation case scenarios where we set PDAs for the patient. You don't know exactly what case, you know what the case scenario playing out, you know, pretty much with vital signs and everything. But I really don't know what the end result is until you go to putting in your medications, hanging your IV piggybacks and stuff like that. But basically, you'll have a patient with some vital signs, and it could change on you at any point with the PDA. You never know when they're going to change on you and what you're going to need to do as a nurse and what meds you're going to have to administer. So simulation labs may be a little different what you're used to, but we do full-blown simulation labs, probably more so than what you're used to. But we also have central line kits. Up here, as you'll see, we teach you about central lines, so we do central line kits. There's not much that we don't do or don't have up here to be able to teach you anything you need to know on a skill or giving a medication. And like I said, we're very proud of this lab over here. So if you have any questions or you ever want to come over for a tour of the lab, just let me know. And if you have any questions, then you can email me. Thank you.